One America's John Hines was on Capitol Hill, as he always is. He spoke with Senator Mike Lee about why he believes the repeal and replace effort failed. Take a look.
Hello, I'm here with Senator Mike Lee of Utah. We're talking about the Senate health care bill. And Senator, I know that the health care bill seems to be on indefinite, shall we say, hiatus for now. The fate seems somewhat uncertain. Tell us a little bit about what happened.
What happened was the bill reached a point where I decided I couldn't support it, in part because we had veered so far from our original promise, which was to repeal Obamacare. And we were doing not enough, I believe, to make sure that we were lowering health care premiums for America's middle class. So I signaled that. My colleague Jerry Moran joined me in that in addition to Rand Paul and Susan Collins. Brought us to the point where we were not going to make it past the motion to proceed. Well, I'm not sure what happens next. There's talk now of possibly proceeding to the bill with an eye toward passing the House-passed bill, getting onto the House-passed bill and substituting in the 2015 repeal measure. I'm not certain where that's going.
Now, of course, you and your Senate colleague, Senator Cruz, were able to add an amendment. Was that exactly what you had in mind, or did the language change there, or how did that play into this?
The language changed. You referred to the Consumer Freedom Amendment. Senator Cruz and I worked on that together. In its previous iteration, I supported it wholeheartedly. The subsequent iteration, negotiated by Senator Cruz, was something that still did some good, but it didn't go as far as I thought we needed to go in order to protect middle-class taxpayers. One of the things we were worried about was the cross-subsidization issue, the issue whereby after all of the tax subsidies, the government programs, everything else that goes into health care, when middle-class voters, people who buy insurance, are asked to pay higher rates in order to obscure the higher cost of health care brought about by Obamacare. That's called cross-subsidization. And my concern was the final iteration of this amendment didn't do enough to reverse this cross-subsidization trend.